clinical trial that I'm currently involved with actually uses the measles virus, which was mentioned in one of the previous presentations as an oncolytic virus, and we are administering this virus directly into the pleural space using a Pleurix catheter with the hope that the virus will potentially directly kill tumor cells by recognizing them more better than the surrounding normal cells, and that the virus might also function as a vaccine, triggering an anti-tumor immune response as an additional effect here. And our study is currently a phase 1 study, which is fairly early in its development, and that's what my clinical trial involvement is at this time. Certainly, as Mary pointed out, as pulmonologists, we are typically more involved at the beginning of the disease, specifically diagnosing the disease, staging the disease. But from my perspective, I think it's also important that we follow through and are involved in the therapeutics of the disease.
Dan?
So I come from a very similar background as Tobias. My background is as a pulmonologist. I also am one of the pioneers in a relatively new field called interventional pulmonology, which is new here in the United States and involves, it's kind of a hybrid between some aspects of thoracic surgery and pulmonary medicine, in which we use scopes in the air passages and in the chest cavity to diagnose and treat chest cancers and other diseases. And my interest is in combining some of the things that Tobias said, which is the ability to deliver novel treatments, often which involve stimulating the body's immune system to fight cancer, and then using some of these other instrument-based techniques, the scopes, into the lungs and into the chest cavity, into the pleural space, to both deliver and monitor the benefits of therapy. So I'm a plumber, but I'm a plumber that is an interest in what's going on inside the plumbing. And my goal is that we work together as a team. I think that the answers to mesothelioma are not going to come from one discipline. It's not going to be just from surgery or just from radiation therapy, just from medical oncology. So I think that pulmonologists are used to working as part of a team. We often have to take a team approach to diagnosing patients and managing them, and so that we fit in very well to the team that's going to manage patients with mesothelioma, both in the fact that we can help with the diagnosis and the staging of the disease, as well as helping in guiding the best therapies. And it's always good, I think, to have a pulmonologist on board if you're discussing, for example, surgery or radiation therapy, because underlying lung function is going to have a great impact upon whether or not a patient's going to be a candidate for an intervention. A patient may be a perfect candidate for surgery, but may not be someone who could survive the surgery from a lung function perspective. So I think our general pulmonary skills do come in handy, even though we're very interested in the scientific side.
So, Tobias, I wonder if you could just the basics. After an extrapleural lumenectomy, how does a patient breathe? Could you sort of explain, how the other one will take over, and sort of some of the changes of, what are patients to expect following that type of a surgery?
Yeah, the extrapleural lumenectomy is obviously a very invasive surgery. As you've heard in some of the previous presentations, during an extrapleural lumenectomy, the lung as well as the pleural surfaces are pretty much excised in an en bloc procedure, so they all come out as one piece, so to speak. And what that pretty much does is, not only does it mean a lot of trauma to the patient, so it's a big surgery that causes quite a bit of tissue injury and results then in has to require a lot of healing afterwards. You also pretty much lose 50% of your lung function in this context. And it's also important to know that as we all go through life, we acquire lung diseases that affect our lungs. And so if I say 50% of your lung function, you're basically left with the other half of your lung, and that may be affected by a different disease. For instance, some patients smoked during their use, and they may have COPD or emphysema, which may affect the other lung. So it may not be exactly 50% of the ideal lung function. So it really drops your lung function quite a bit and causes, in that context, your functional status to potentially deteriorate, and in some situations, patients to be left with a functional status that would be very difficult to maintain their quality of life and potentially require oxygen. And obviously that's one of the things that we try to avoid by selecting patients appropriately when we decide what surgical procedure they are subjected to, that we actually really try to preserve quality of life as best as possible and preserve lung function as much as possible with these surgical procedures, and try to do this in a proactive fashion where we actually try to select the right candidates for the right surgical procedure up front. Because in contrast to extrapleural pneumonectomy, pleurectomy and decortication, the competing surgical strategy is designed to preserve the lung, and therefore patients actually typically end up with more lung function at the end of the procedure. But I think it's important to recognize that it is a dramatic change. That being said, typically, if you have healthy lungs, one lung actually can provide pretty good function for a patient. As is actually an example for that is when we perform lung transplantations. In patients with end-stage lung disease, we actually frequently only transplant one lung, and patients can gain decent lung function after a single lung transplant.
Dr. Sturman, following an extrapleural pneumonectomy, if you develop a pleural effusion, how safe is it to insert a Pleurex catheter for draining those infusions at home?
Are you talking about on the side where the pneumonectomy was done?
No,
or the
I'm talking about the
opposite
contralateral side when the disease
I think
returns.
it's very safe. I mean, you have to use ultrasound to guide those procedures. And I think as long as you're using ultrasound guidance and the person who's doing the procedure knows what they're doing, it should not be a problem.
Okay.
I mean, the biggest concern from my perspective is that when you have a pleural effusion on the side of your remaining lung, that it's a harbinger that the disease has now recurred in the site where you only have one lung remaining, and it's a bad prognostic sign, unfortunately. So I think we can do procedures, but from a prognostic perspective, I think we have to be honest with ourselves about what it means to have that pleural effusion on that side, if it turns out to be positive, for example, for tumor cells.
And how do you manage, what is the rate of infections once you've inserted a Pleurex catheter? I believe it's pretty low, am I correct?
It's 5% or less in general, and most of them can be managed by a course of oral antibiotics, leaving the catheter in place.
Okay, great. Radiation-induced pneumonitis, we hear about that a lot. Could you explain a little bit about what it is and then how is it managed?
Sure.
Okay.
Yeah, so radiation pneumonitis is pretty much an inflammatory response that's caused by the ionizing radiation exposure of the lung. We really manage this with anti-inflammatory therapy. So for the most part, that involves a course of prednisone that is administered to these patients. The dose and length of the therapy varies a little bit between centers. So a lot of this is what centers have established in their experience of being helpful. But, and in addition to that, you try to provide supportive care to the patient. Obviously, we are trying to limit radiation pneumonitis also, again, when we plan therapies for these patients. And that highlights again, the point that Dan already made, that this is really a team approach. And that's how we look at these patients, that this is a multidisciplinary team that's looking after the patient, where really all these specialties, radiation oncology, surgery, medical oncology, and pulmonary medicine actually come together and take care of an individual from the beginning, where we plan the therapy, and in the context of planning therapy, trying to minimize the amount of radiation exposure to the lung that's not affected by the disease, or the lung itself, and then really focusing the radiation to the surface of the lung where the tumor is, using a strategy called IMRT. It's really something that you're doing up front to try to prevent these complications like radiation pneumonitis. But when we encounter it, it's an inflammatory response caused by the ionizing radiation that we then treat with anti-inflammatory agents.
I just want to comment that it's important to distinguish between radiation pneumonitis and radiation fibrosis. Radiation fibrosis is the scarring, which is often the result of radiation-induced pneumonitis that may have been treated or may not have been treated. The important differentiation is that the medications that Tobias was mentioning, the anti-inflammatories often have their own toxicities. So prednisone and other steroids can be toxic when taken for long periods of time. Many of you who are patients in the audience have been on these drugs, and there are side effects. And if you're giving that for someone with radiation fibrosis, with fixed scarring in the lung, there is really no benefit and just harm. So it's very important to distinguish between whether there's active inflammation in the lung that would benefit from steroids and fixed scarring that's not going to benefit. And there are also some other side effects of radiation that we do see. We actually see pleural effusions on occasion, and it's really important from a prognostic perspective. We were just talking about pleural effusions on the side of the remaining lung. If you've had radiation, it's not uncommon you get a small pleural effusion and you drain it and there are no tumor cells in it. And that is just from radiation injury to the pleura itself and not indicative of a progression of the disease. So very important to distinguish. And then we're often seeing, I can't say often, but we're occasionally seeing some patients with heart problems from radiation therapy and the complications that may arise from that, especially the pericardium, which can become stiff and limits heart function. And sometimes pleural effusions occur because the pericardium becomes stiff and scarred from the radiation therapy. So I think it's important to remember that radiation therapy is quite beneficial for a lot of our patients, and relatively few of them have serious complications. But I think as pulmonologists, we have to be aware and help our colleagues in radiation oncology in terms of managing these patients.
So I often hear from patients, or I suggest quite often that they go for pulmonary rehab. Can you talk a little bit about what pulmonary rehab means and how often you refer patients, or the type of patients you think will benefit from pulmonary rehab?
Yeah, and I think that's a very common question. Pulmonary rehab as a program is actually very similar to cardiac rehab, which is a structured exercise program where people actually get monitored and actually get taught pretty much aerobic exercise regimens as well as some breathing techniques. So these programs run for 6 to 8 weeks and are pretty much designed to introduce patients to a regular exercise schedule and make them actually comfortable exercising with the goal to exercise on their own. And I really liked the comment that one of the previous panelists made, actually Dr. Sugarbaker, regarding that this is kind of a athletic event going through these types of therapies. And I'm actually personally not necessarily focused on sending people to pulmonary rehab or cardiac rehab. I think the patients need to do what they are comfortable with. Everybody needs to understand that maintaining your health and maintaining physical activity through these very difficult treatments is actually very important for a good outcome. It actually raises your spirits. It kind of keeps you sane as you're going through all these treatments. And it also, I think, in my mind, has a positive effect on the immune system, on everything else in your body, and trying to figure out the best way to do that, I think it's very important. And if in that context pulmonary rehab is helpful, I certainly am happy to refer people to pulmonary rehab in this context.
I would say we've underutilized pulmonary rehabilitation, and maybe we're babying our patients a little bit, but I fully agree with what Tobias said. It's extremely helpful. It's non-toxic. It's generally reimbursed by insurance companies, and it can be extremely helpful. The other part of it is that it's often sort of group therapy. So when you go to pulmonary rehab, there are often other people going through the same process, maybe not all who are recovering from surgery or treatment for mesothelioma, but all who have some impairment in lung function. And there's some benefit to supporting each other during that process. So I think my patients who have gone through pulmonary rehab enjoy it. Part of it is gets them out of the house, doing something and being active and being part of a community.
Maybe giving a little bit of a control back to a patient.
It's actually, and we are trying to expand this into mesothelioma. We actually have a very active program at our institution that's actually focusing on the rehab aspect, but then also of self-empowerment of patients, where you actually kind of take control of your disease and you actually actively are involved in the care, but also actively are involved in doing things in your activity during your daily life and activity of daily living. And that's actually been very helpful for other patient groups already. So we hope that this will also translate into help in the mesothelioma community. But for instance, the chronic obstructive pulmonary disease, it's actually been very helpful beyond just the physical exercise part of this.
And I'm also wondering, cough, chronic cough seems to be such a complaint in this community. tricks of the trade. First of all, what is chronic cough? What is the cough? What are the underlying causes of the cough? And then maybe what are some of the remedies that are used? And I know I'm asking, it's a wide open, I know there's a lot of different reasons, but if you can go into some of the basics or what the most common causes of cough in a mesothelioma patient.
You have to understand that I think it's easier to treat mesothelioma than it is to treat chronic cough. Chronic cough is I think the most difficult diagnosis that a pulmonologist has, and we often dread when a patient comes in, especially when they've been through multiple other physicians first and then they come to you and they've had exhaustive workup. So in the context of mesothelioma, the chronic cough can be from a multitude of things, and it really depends whether they're newly presenting and there's a large pleural effusion, or whether they've had radiation therapy and there's radiation fibrosis, or they've had surgery and they're just recovering. So it really depends upon the context. But it can be a very difficult thing to treat, and there is no one drug to use. I think that one of the things that we'd like to avoid is over-medicating people with chronic cough. Narcotic medications are okay for treating chronic cough, but they over-sedate patients, and if you have marginal lung function because of underlying disease, including mesothelioma, then suppressing respiration is not a great idea, and it doesn't get at the root cause. Cough is extremely complex. In general, for patients who don't have mesothelioma, for patients who come to pulmonologists, the most common cause of chronic cough are postnasal drip, sinus disease, so nose and sinus disease, and reflux disease. So I think the first thing that we do, at least that I do when patients come to the office, is aggressively treat your postnasal drip and your esophageal reflux. And it may be that post-surgery, for example, in mesothelioma, your reflux may be worse. So you may need that more aggressively treated. So that's something that we can relatively easily do, although medication doesn't always fix the problem because it may be an anatomic issue. Your stomach may have moved up in the chest with your diaphragm after surgery, and that change of position may increase the amount of reflux that you have. Sinus disease and nasal disease are very, very common. And so treating that aggressively, getting ENT doctors involved if you have chronic sinus problems is also important. So I think I work on those. And then asthma is the other thing that we see. Asthma is a very common disease. Mesothelioma is rare, but there probably are many patients with mesothelioma who have underlying asthma who aren't being adequately treated. So I think the first three things that you treat are underlying asthma, postnasal drip, sinus disease, reflux disease. After that, you're getting into a very big gray zone of where other things can come into place. In terms of tricks, beyond that, there is some data using a drug called gabapentin or Neurontin that was recently published in the journal Lancet a couple of years ago for the refractory chronic cough. Again, this is a drug which is used for just about anything, chronic pain, seizures. It's been studied in chronic cough. I don't have a lot of experience with it, but it's something that I'm trying for my patients who are just not responding to anything else. And now I'm going to pass it to Tobias and see if he can enlighten me on what he does.
No, and I have to agree with Dan that in general, we also focus first on these three most common causes of chronic cough, and we make sure that since mesothelioma is a rare disease, common things being common, you still have to make sure that it's not one of these other three big players in the context of chronic cough. If that's not the case, the other important thing is to really make sure that the patients actually understand what cough means, and that cough actually serves a physiologic function, meaning clearing your airway, and that having the occasional cough is actually not necessarily a bad thing. So I really try to understand how debilitating cough is. If, of course, cough becomes debilitating to the degree that patients cannot go out and attend social functions and cannot sleep at night, these are the kinds of patients, if you don't find the cause of their cough, where you want to look for anything possible to try to alleviate it on an individualized basis, such as dealing with the pleural effusion very aggressively, or trying to eliminate other potential contributors. And if that's not the case, then we're pretty much down to symptomatic therapy. And Dan already pointed towards the gabapentin. Another thing that we've used on occasions, actually with quite some regularity, is actually just topical anesthesia, so nebulized lidocaine, to basically provide a numbing effect in the posterior throat, in the back of the throat, to try to break the cycle of coughing and trying to make people more comfortable. But similar to what Dan was saying, the problems with opiates, obviously opiates like morphine and other opiates, they suppress cough at a central level, at the brain level. And in this context, they can make people drowsy and can make people difficult to function during the day. Lidocaine doesn't do that, but of course lidocaine, if you numb up the back of your throat, it's pretty much like going to the dentist, and it becomes very hard to eat and drink after that, and without getting things down the wrong pipe and aspirating. So all of these things have their pros and cons, and if you don't find any of these big three causes, you're pretty much stuck trying to individualize therapy as much as possible after you determine that this patient really needs some help with the cough.
Oh, so I'm hearing vaporize, I'm thinking about medical marijuana now. So what about, you know, people who are giving prescriptions for medical marijuana who have one lung or compromised lungs? How does inhaling these type of substances, does it affect the lungs, does it hurt breathing?
To be honest, I don't have a lot of experience with that, so I guess in the state where I'm practicing, there's I don't think I think there's a way to get medical marijuana. It's not been really in my practice that much. I don't think that it would have a very detrimental effect on the lungs theoretically, but
it's important to understand that you don't have to smoke medical marijuana. That medical marijuana comes in a liquid form that can be put in foodstuffs, and that's how it's often taken. So it's hard to recommend someone who has underlying lung disease to smoke something that's going to make them feel better. They can take the same substance orally without injuring their lungs, because even though medical marijuana has clinical benefits, there are downsides to the lung to smoking marijuana, which are well proven. So I would recommend that if someone was prescribed, they lived in a state where medical marijuana was legal, that they get the oral form, however it is best administered, and not smoke the drug.
So Dr. Sturman, I'd be remiss if I didn't ask you about what's happening with your gene therapy trials, because I know you've been championing gene therapy for so many years. Where are we with those trials now?
Thank you for asking, Mary. We appreciate it. So we just completed, is that 5 minutes to go? Okay. Thank you, Melinda. That wasn't a 5 out of 10 for our performance so far?
That was 5 more questions.
Okay. I thought we were on a 5. I thought we were up at like at least 8.5. We're doing really well. So we completed at the University of Pennsylvania, I think the largest gene therapy trial ever in mesothelioma just this past fall. When I say completed, we enrolled the last patient. We're still following many of the patients in the clinic. And this was 40 patients, started in March of 2011. We finished in 3 years. We're summarizing our data and we'll be submitting it, presenting it at the International Mesothelioma Interest Group meeting this fall in Cape Town, South Africa, and hopefully also submitting for publication or at the same time frame. So what we did was take a drug which is a virus, a virus that causes the common cold, and this virus has been modified so that it can't cause illness in human beings, but it carries the gene for human interferon alpha. And this gene gets inside cancer cells and causes cancer cells to produce the interferon alpha within the tumor cells themselves and stimulates the body's immune system to recognize and start to fight the cancer. And we give this together with standard of care chemotherapy, both in the front line with pemetrexed and in the second line with gemcitabine. And so the study is stratified between front line and second line patients. And particularly in the second line, we appear to be seeing a significant signal in terms of benefit, in terms of long-term survival. So we hope to analyze all of our data in the next few weeks, submit our abstract to IMIG and submit our paper, but also we are in the planning stages right now for the next phases of clinical trials, including what we hope would be a multi-center randomized clinical trial in the second line between gemcitabine-based chemotherapy versus gemcitabine-based chemotherapy with the gene therapy combination. So we're very excited. We're not enrolling patients currently because we're trying to decide which direction to go in, and we hope to be restarted relatively soon.
That's great. So when you do disclose the results, I know that we'd be very interested to get it out to the community. Thank you. I have one question that came from the audience. It's sort of taking us a little off track, but do you see any late effects of radiation? So in other words, not in the immediate time period after radiation, but maybe years later, do you see any long-lasting or any new side effects that develop over time?
And yeah, with the acute radiation pneumonitis is what we discussed, but there is radiation fibrosis, like Dan pointed out, and this radiation fibrosis in some patients actually can be progressive and can basically cause progressive scarring of the lung, which then presents as more of an interstitial lung disease that can limit the breathing capacity of these patients. And the same is true for some of the other organs that, specifically, for instance, the pericardium, the sac in which the heart is basically enclosed in, that late effects of radiation could be scarring of the sac, which can then limit the ability of the heart to expand and basically perform its pump function. So these...
Lucas Neal has the disc and... oh, it was out of bounds. So it's coming back somewhere. I reckon at least halfway, if not further. Okay, but that's not a girl. I wanted a girl. I tried to get a girl commentator, but they... Girls know our names. Right. Well, he seems excited, so we'll see what happens here. You don't have to. So I've got a oh, hang on. We'll just call the rest of this. So UQ has a disc in the zone. They're working around with a lot of short passes and basically trying to break the mark a lot to get the disc moving. And if you're going to do that, you want to do that early in the count, really. You don't want to get in trouble. There's a bit of looseness from the Sydney Uni zone, but there's no space to move it across the field. So at the moment, UQ's kind of going backwards a bit. And they're really focusing on stopping the poppers, which they're doing pretty well. And right now, they're in a bit of trouble. Oh, nice pickup by Mueller. Ooh. But the swing doesn't work. And we got a bit of weather coming through. And it's turned over. So I introduced my co-commentator.
Hello, I'm Liam Grimmond. I'm a coach of UQ Women's and a long-time member of UQ Ultimate. Well, thanks for having me, Potsy.
Yeah, no worries, Liam. Glad to have you. I did ask for a girl, but got Liam, so I don't know if there's any sort of message in that. Can you just hold the mic for a sec while I mic up?
I'd like to do a quick shout out to Marcus Lees, get 60 over the field. Marcus Lees, your presence is known. We got Goose walking it up to the sideline. He's going to have to try and get off this sideline from a good UCID trap. It's a bit wet. It's pretty windy. Perth has thrown a lot of this weather at us. It's good around by Goose. Hits Linus. Keeps it all the way to Andrew. Linus, one of the bigger bodies in Australian Ultimate, finding himself behind that disc. He's got such length. He likes to get rounds. Oh no, just as I'm speaking.
Yeah, the previous catch, he just casually took one-handed and then he tried to do it again. There's a limited number of times you can do that, especially in a bit of wind and with a slippery disc. Latamatis doesn't quite get the air under that disc and it goes to ground. Oh, and it's going into play. Interesting. They asks for a check disc, tries to put it into play, puts it back on the ground. I don't know what's happening. Anyway, Linus Mueller with the disc in the zone. They break through, and that's crucial. And that's a Grace grab. Back to Linus Mueller, but tries to push it through once too often. Very different style from Sydney Uni that we're very happy to just punt it and hope. And so Sydney Uni's moving it downfield now. Floats, that one caught a bit of wind and went over Rob Andrews' head.
That's the game we were expecting. We're expecting both teams to just huck and... Oh, go on. Both teams very big, very athletic. We're kind of hoping to see a bit more aerial battles, but the wind's made that pretty challenging. We got some great matchups out there. We got the Guck versus Rob. We got Linus versus every other big dude on UCID. And Goose v Lado. That's been a great matchup to watch.
And we're going to try and use real names. Because we're not Roy and HG, are we? because we're not. And we just have to live with that for the rest of our lives. Latomatis with the disc on the far sideline. Throws the scuba. Yeah, not everyone has a towel, Latomatis, so I don't know. Oh, that was going to be a tough catch. It maybe needed to be one-handed. So, Linus Mueller bring the disc very deep on the field, maybe 5 metres out of the end zone he's indicating. Again, the zone, but the zone is a bit looser right now, or maybe it's waiting for some poppers to appear. This is the sort of thing the Latomatis loves, the zone and the tactics of zone. So I'm sure he's fine-tuned the Sydney Uni zone over many hours. And UQ's into a bit of a rhythm, swinging the disc at the moment.
Yeah, we have Zalzi right now doing some great popping. Oh, a beautiful shot through to Hickman. He's a Canadian import. Can he hit the inside? Oh, he hits it straight through to Guck. He's going to have a look. Will it be put? Linus has put it up to James Fryer. James Fryer's closing. Rob's closing. Hey, that's great. That's a great close by Rob, hey? Nice find.
That was worth a shot, I reckon. But yeah, Rob Andrews read that really well and made sure of the D. But that was a nice little passage of play. They got through the cup, they penetrated the cup, and then they kept the disc moving. And you've got to do that. Once you get your advantage, you've taken your little risk to get through the cup, you just got to then press that advantage and keep trying to get the disc moving up the field as much as you can. And look around. Well, you need to have the mic. Yes, Liam was speculating whether they'd punt it, and they probably should have punted there, Liam, I reckon.
Let's see UQ's end zone. Are they going to go match defense? UQ a bit more comfortable working to the end zone from a few meters out. And, oh, just not in there. It really is trashed by a few players. Can he keep chilly? It's a beautiful, classic Singaporean blade. It's just out of the hands of James Fryer. Great second bid, but can't come down with it. UC back on offense. Will they punt it?
So this has got to be the 10th turnover each in this point. The score, it's hard to believe the score is still only 1-0. Sydney Uni hasn't looked that great downwind. They haven't really done much. You really would expect them to be able to play easy offense downwind and score, but they've been giving the disc away pretty cheaply.
Surely you just want putting Rob in the end zone and getting Alex Latomatis to put a big old IO in there. Let's see this big aerial battle between Mueller and Rob.
Yeah, no doubt we will see some of those matchups this game. So they're just trying to get a better disc, and Latomatis uses the towel to try it, doing a bit of directing. They're happy to chuck it around a bit in their own end zone. I'm not sure what their plan is here. Lucas Neal wants to, that's sharp, but it works. And they're still working it well. Little give goes. That was a very strange way of trying to catch the frisbee, and there's a reason why it was strange, because it's ineffective. So UQ gets it again from Sydney Uni, who've been running now downwind. Really? A travel is called. I don't know if you saw that at home, folks, but that's about as questionable as it gets as a travel call. But you know, so it is, and yeah, it was a good run through intercept. Latomatis has a disc Miller field. I think now it's reasonable to try and work the disc from here. What a great grab. Well, he learned how to catch in those intervening 30 seconds, so that's good to see.
It's great composure. You said moving it downwind. Maybe they're onto something by not hucking and hoping. See the UQ boys rally now. Hopefully we'll see some beautiful 1-2 pass offense from them moving downwind. Get the D line back out there, use their legs. But yeah, shaping up to be a great game. What a long point.
Yeah, the weather's improved. The wind's actually died a little bit. As I say that, a gust comes through, but I think that's the worst of the weather. So it'll be a bit more of an open game now. That's disappointing for UQ, I think, because Sydney Uni came out, got a break, got an upwind break early on in the first point, and then UQ attacked the end zone like 3 or 4 times and couldn't score, and that could hurt them later in the game, I reckon. Like having that many opportunities and not being able to convert, let's put them in a little bit of a deficit right from the start of the game, and especially against this outfit, I think it's pretty difficult to. You don't really want to give an advantage if you're going to avoid it.
No, yeah, UQ are definitely knocking on the doorstep. Just gotta find that one pass into the end zone. Expecting a pull play with Linus Mueller getting the disc under, hitting Sam McGuckin. They're probably likely to play a trap zone and force an early turn from USID. Hopefully we see some clean offense from a UQ.
Yeah, I think those first 2 points were pretty scrappy. I imagine we're not going to see too many more points like that until maybe the end game. I think we'll see them clean up their offense a lot more. But there you go. Was there a touch on that from Fraser McDonald? Maybe there was, but UQ's pulled it in. Liam, maybe talk us through this possession. Hey, you blinked. It's not them. They don't have it anymore. Ladamanis has it. He swings it out. Yeah. I'm at a disadvantage because I only know some of the Sydney Uni players' names. So I'm sorry, Sydney Uni. And I know some of their first names and not their last names. Right on the end zone line, Ladamatis, he's going to throw the goal. And he does to Rob Andrew. That was a bit easier, a bit quicker. 3-0. UQ needs to rally.
There was about 8 people around that disc, and they still managed to find the USID player. UQ really going to have to rally now. There's a timeout being called. Let's hope the boys can have a chat and really come out firing. Props to USID for working it up and getting the early turn. UQ boys are really going to have to get down to the other end zone. Oh yeah, the boys. Let's go the boys. That's some classic nonsense from UQ.
Liam's going to keep charming you while we just move the camera out and try to get a better camera angle. Okay.
Fun fact: I actually played with Fraser McDonald in University of Edinburgh. He's a great lad, sporting the mohawk. He had the great bid on that around. Don't think he got a touch to it, but he pressured the throw. Really popped up there. USID and UQ previously met in their pools, and they were trading pretty evenly. UQ came out firing. They're seeming a bit lackluster now. We see Andrew really firing up the boys for UQ. Getting around each other. They got to score 1 and get out on D. Really use their legs.
So here you played under 23s last cycle, is that right, Liam?
That's correct. Blue Bottles, Yuang, what a coach. After Coach of the Year, led a great campaign, and we're hoping to see some more great coaching come out of him very, very soon. But yeah, it's good to see the big Queensland contingent coming out of this UK team, hoping to play under 22s over in Perth in 2018. So it's good to see a strong showing from them in the finals.
So I don't know if you heard Liam, but I'm actually a UQ alumni. So it's all UQ commentary team here, and we should be very biased, but I'm not. Yeah, I did engineering back in the late 80s, early 90s. Yeah.
I mean, there's been a few good players who have come through UQ. Brett Matsuka, he's a UQ alumni. We have Johnny Mack, Chris Cunliffe, and Potsy yourself. Yeah, UQ has a pretty strong program, and I think the fact that they're in the finals shows that.
I taught Matsuka everything he knows, but I feel like a jilted lover now because he never returns my tweets. But yeah, he's definitely gone off and made a big name for himself over in the United States of America, where the big boys play. Rob Andrews sends a roller down, easily fielded. It's an interesting choice of pull, I think. Maybe he didn't execute the way he wanted to. I'll give it to Liam to call.
It's pretty still now. We got Jack Allen and Andrew Hickman bouncing to Chris. He's a Malaysian import. Got to get off that sideline. Easy swing to Mueller. Mueller, big high release to Andrew Hickman, using that length to great extent. Beautiful inside to Z. Move to Goose. We've found through the middle now. Are they going to take the shot? No, they're moving it. Good swing. UQ have found their rhythm now. That chat from Hickman has also got the boys fired up. They're focused. It's been a tournament of zones. They've got their eye in. That's a great shot. Big bid from Lulu. He comes close. Just going to keep it swinging. Let's get the disc into the hands of Linus. He's looking safe with that disc at the moment. Straight to Z. Those gloves serving him well. Friction gloves.
Is that the boys' bullets?
The boys' bullets moving it well. Linus, look at that length. Throws it easy around. Goose, big pump fake. Pivoting with great ease. Look at Linus, use that body. Throws you around to, a huge bid from Sam McGuckin, but can't connect. Once again, knocking on the end zone line. The boys just have to put it in.
Yeah, they were looking really good, but I think, possibly a little bit over-ambitious, that shot into the end zone. Need to look fat side. There's always lots of space out on the fat side of the field to throw your big throws. So, for the umpteenth time already this game, Latamatis is bringing the disc in. Throws a big crossfield blade into the fat side of the field. And the younger Andrews shows everyone how it's done. Oh, I don't know what's happening here. They've called a travel again. But they're retracting. No, they're not retracting it. It seems like some of the Queenslanders went to the Tom Regacki school of ultimate calling dodgy travels all over the place. But anyway, he's like 10 metres free of everyone. I reckon he should travel again. Anyway, hopefully he just throws an easy goal here to make up for that. That's easy. Oh, and the disc never lies. Clearly that was a blatant travel that deserved to be punished with a turnover. But anyway, UQ gets it in the corner. Linus Mueller with the disc.
I'm going to stop you there, Potsy. Tom Regacki is the greatest frisbee player of all time. The greatest frisbee player of all time. Let's keep.
Sure, but he just doesn't know the rules of ultimate.
Chris Stan on the sideline now. Great shot up the middle to Z. Z swinging now. He's looking for Linus. Linus being so effective around the disc for UQ right now. Fine Z, what a shot. All the way to Andrew. Oh, and we have an injury on the sideline. Let's hope he's okay. He received a little shot from Linus there. Linus using that length to there's a bit of discussion now about where the disc should be. I'd say if the person marking Linus is on the ground coughing, the disc is brought back and we keep playing defense and some clean O. Yeah, I think that's probably right. Lado saying the disc to back on Z. And you should get another shot. They're looking good upwind. Just got to get one. Oh. It's classic Singaporean ultimate. They get so low, such low releases. They're so hard to guard. Is he doing well to stay in? Got a big grin on his face while playing. He loves this game. Down is the call. Oh, and I've just been talking up the low releases, and it's just brushed the grass as he's let it go. Potsy.
Yeah, it's dangerous. It's like playing with fire sometimes, those sort of throws. But yeah. So Latamatis, again, is the one putting the disc into play for Sydney Uni. And Lucas Neal puts it over the top. Lucas, yeah. And Lucas has disc to Latamatis. Oh. And UQ's going to walk it up to the front cone. And they're setting a zone again, of course. So it's going to be tough for them to work it out of that corner, I think.
Oh yeah, I know.
But you know, they've had a couple of chances already this point, and they just need to keep possession of the disc once they get to the other end of the field, but they don't even complete one pass. So this is probably going to be, Latamatis is going to pick it up, and it's probably going to be a pretty easy score, I reckon. Oh, or is he going to let someone else pick it up? There you go. So Rob Andrews is picking it up. It's on the end zone line, pretty close to the cone, a few metres from the cone. UQ is playing kind of poachy. They've spread out around the end zone. That first option isn't there. But, oh, nice read by Linus Mueller. Oh, that doesn't look good. He got clipped on the way through. Hopefully that's just a bit of contact rather than anything bad. It doesn't look so good. Doesn't look good at all. Okay, that's going to hurt UQ a lot, hey, Liam?
Linus Mueller, he's known to be an offensive weapon. He's playing some great lockdown D in the end zone. Gets the heads up block in the lane, and UQ are really going to miss him there. Where you get the block, UQ now get another shot moving upwinds, but let's hope the Linus is okay. Let's hope it's just a knock, and then he can get out there running in a few minutes' time. Goose walking up to the front of the line. That zone is set. Matthew Beavers takes the field. Gives it to Andrew, still on this sideline. Beavers crashing in. Andrew over the top to Goose. They're really losing yards now, UQ. Might be a punt. Oh, Sam McGuckin does well to use his body to seal out the defensive player. Quick dish to Goose. Goose pivoting well through that fence. Little dish to Andrew. And they've already worked it 10 or so metres, UQ. They're getting out of their end zone. They showed that they have the patience. Oh, and it's a great block by Lucas. Reads that inside lane really well. And now UQ are playing D. Lado on the disc. Oh, and it's an unlucky drop from one of the UC boys. UQ.
In what way was that unlucky?
He was too busy looking downfield as was at the disc. I suppose lucky has nothing to do with it, eh, Fotsy? Goose down with the disc, great pivot, great fake, really convincing fakes, little addition to Chris. It's a great crash from Latto. Hickman really being the person to step up and fill Linus's enormous shoes. That boy is huge. Oh, a beautiful little touch throw, can Sam? Oh, and Chris gets up. Oh, a little miscommunication between the two UQ lads. And now we're playing D. Latto on the disc, easy swing. Oh, he makes sure this time. Big gainer. Oh, and once again, oh, it's a great snag. He's now looking upfield. Z on the mark. Easy around to Latamatos. Big fake. And Lucas just generating unders. Oh, got to get that force on. USID knocking beautiful inside to one of the Andrews. USID making it look easy. Great fight by UQ though. What do you say, Potsy?
Yeah. Look, they look good out there, but they got to do a bit more, don't they? Because they're not quite getting at the length of the field. So it's 4-0 to Sydney University right now, and that's a tough position for UQ to be in. They're there's a timeout. They really need to change the flow of the game. So, timeout. Sydney Uni are looking pretty casual about this. They've definitely got the game well in their control. Like, I think the scoreboard doesn't quite reflect how often UQ's had possession of the disc and had a chance to do something with it. A couple of completed passes in the end zone and we'd be in a 2-all game. And UQ's had chances to score upwind. So, yeah, there isn't that much separating these teams, but if you're UQ, you really don't want to be starting the game 4-0 down because Sydney Uni are the stronger team on paper. And, yeah, you want to come out firing, really, in that sort of situation and get on the front foot. So they've got a lot of work to do, UQ, but they've got a lot of strong players and they can definitely bring it to Sydney Uni. At some stage, I'm going to try and get some names for Sydney Uni because that's really where we don't really have the names for Sydney Uni, and I think I'm making up last names for some of the players. Like, I don't think Lucas's last name is Lucas Neal. I don't think he's sharing the last name with Australian soccer captain. So, yeah, I'm sure when it comes to me, it'll come to me. Sydney Uni in the ascendancy. They kind of have control of this game. They're pretty casual. Their body language is pretty relaxed. They're having a fun time. Now's the time for UQ to show a bit of grit and stick it to them, I think. And they got to. It's been a scrappy game, not just in terms of people taking risky throws, and we certainly saw that in the first point, but a lot of drops. Like, you can't come out in a game like this, and the conditions aren't that bad, but we've seen, I don't know, I'm going to say close to 10 cold drops, like in front of the player, on the chest, and they've either been distracted or, not really had their head in the game properly and failed to catch the disc properly, and that's just kind of inexcusable, I think. Rob Andrew pulls upwind. It's a deepish pull. And UQ takes it pretty much on the end zone line.
Goose swings it to Andrew. Boys are moving it quickly all the way to Z. Quick pop to Linus. Good to see him back out there. The boys need him now. Uses that length to such good extent. Seals out the mark with his body. Fraser McDonald being so active for USID on that mark. Oh, and he's bid straight into the defender and generated the turn. Great bid by Fraser. And now USID are knocking on the doorstep once again. Rob's going to clear through. And Latamatos is going to pick up the disc. Looking to get Lucas isolated. Oh no, Lucas is back now, and Rob's on the disc. Oh, fakes the inside, big swing to Latto. Andrew marking Latto now. He's actually playing with a broken finger right now. Shows how much he wants this D. And Usid making it look easy with that big inside. Way to get the other upwinds. UQ have to rally now.
That was a beautiful throw for goal from Lucas, formerly Neil. And I noticed Latamatos is picking up the disc then again after the turnover. So he gave Rob Andrews a chance, and Rob Andrews fluffed it. And so Latamatos is taking charge and said, I'm picking it up every time now. He might even take a sub, Latamatos, at this point. I think he is. Yeah. So they are definitely cocky from that point of view. But Alex Latto is pretty strong on the disc and makes pretty good decisions about where to move the disc. And I think, especially in those situations when you're just outside the end zone, you need to have someone with the disc who wants to throw the goal. Because the worst situation to be in is to have someone with the disc who is worried about turning the disc over, or you need someone who wants to throw a goal, because against good defense, you've got to take a little bit of a risk to get the disc into the goal. Yeah. So another upwinder for UQ, 5-0, a bit of a blowout. UQ's shown that they can work the disc up the field. It's a nice pull. That's better than his last one. And that's a one-handed grab over his head from Linus Mueller. And he's certainly recovered from that knock to the knee. Quite dynamic out there. Running the pop. Yeah. Oh, that was tough. It was right. He had to try to toe the line and bring that disc in. So Sydney Unis bring it in. Oh, Rob Andrew picks that up. That was a tough grab behind his body. And I'm not sure if that kind of just came out of the hand wrongly. I think it might have. So a turnover. But it was good defense from UQ. They shut down the option, the early option, the handler options, and kind of forced Rob to do something he didn't really want to do. So UQ's walking it up. They've got a zone. The wind just picked up a little bit more, and they've got a tough task ahead of them.
UQ really got to start making some big plays. Get some energy. It's going to come off the backs of Linus, off the backs of Sam, getting up and making some scalps, and just a lot from Linus, thinking about the next throw.
Like, that is another receiver error from a top player. Like, he had his foot on the line. There's no point in looking at the line while you're trying to catch the frisbee. But anyway, he did that. I think he knew he did a silly thing there. And yeah, a little bit of rain's coming through, but I don't think it's going to last very long. So we'll stick it out. Great block. Great block there.
James Fryer, oh my goodness, I can't even speak. James Fryer comes up huge for UQ. That's the sort of play that we need to get the boys back on. A little bit of a bubble there, but we're good, we're good. Let's get Linus on that disc. Linus using that length to great extent. Cheeky one to Z. Z moves it to Goose. Now UQ are moving, now they're cooking. And Linus back in the driver's seat. Oh, and a little, and we've seen everything now. Z making plays with Usid. Throws a beautiful inside, and once again, just another drop potsy.
Yeah, that was a bit sharp, that one, but yeah, still, if it goes to hand, you should catch it. The highest level. Oscar with the disc. He takes the easy dump option, get the disc moving, but they didn't swing it off that, and they haven't got any real continuity happening right now. Interesting option. Like, it was a tough ask. and not completed. UQ's going to bring it in on the far sideline now. They look good in that zone, but you know, they just make a mistake, don't they? Like, they're not real. These are unforced errors. I feel like a lot of these errors from UQ, like that, is an unforced error. Don't you think, Liam?
I would say so. I've seen Goose. Goose has had a great tournament so far. Jack Allen has been making those throws day in, day out, and the wind just pushes it down just a little bit. You know, he's looking balanced when throwing those, and we see Rob throw the beautiful, uses that length to a great extent, and throws the high release backhand for the score. UQ at the fire now. We've seen James Fry get that huge block. We're going to bring that on offense, start making big plays, use those big bodies. There's some big athletes on UQ. Just got to start trusting them. Let's see what UC. I'm going to say UC will probably throw his own, but what do you reckon?
Yeah, I think so. So Liam, tell us a bit more about yourself. Are you in the next under-24 cycle, or?
I am, yeah. I'm one of the few Queensland boys who'll be going down, hoping to have a run at the Goannas, the under-22s Opens team.
So you playing under-22 nationals?
Yeah, I'll be there. That's in Geelong, right? In November, yeah.
Oh, you're clearly excited. You haven't even looked up where it is. But you better get the froth on, mate.
No, hey, Queensland boys are coming down to win that tournament. You better watch it. There's a good bunch of returners in Alex and Elliot, who are previous Goannas. And some great connections coming out of QT, who got bronze last year at AUGs. Queensland have probably the three biggest players in Australian Ultimate playing from Townsville as well. They're all over 6'5", 6'6". They're just enormous. Yeah, the Southeast Queensland boys are really looking forward to mixing it up with some Townsville lads. UQ are looking really strong. Queensland should say.
Yeah, sure. Queensland, yeah. We all have multiple allegiances. So I'm also a Queenslander. Not sure who I'm going to support at under-22s, but probably. If it's a state-based competition, there's no way I'm supporting New South Wales. The dirty cockroaches. No way. Yeah. No, state-based competition, I'm definitely on the UQ bandwagon. I'm on the Queensland bandwagon. Okay, so Linus Mueller, that has been the easiest point. Well, the only point that UQ has scored, but also like the easiest bit of offense they've had. Few passes and they've scored.
We've seen it at Nationals, Linus Mueller getting big in the air. He's a tough man to guard, put something up, he's going to go bring it down. And then you've got Sam McGuckin, one of the speediest ultimate players out there. Closes the gap. Linus puts up something with a bit of shape that Sam can read easy. And that's how offense should look. Hey, the boys, they found their offensive rhythm now. They know how to move through that zone. Let's see some legs on D. We've got James Fryer back out there in the trackies. He's nursing 2 previously torn hamstrings, so he's trying to keep them warm. We have Goose out there looking to anchor that D-line. We've got Sumin Rowe in the orange boots. Sumin Rowe, you might notice him from Halibut 2016, where he took on the great Mike Neal matchup and generated somewhat of a turn, so he can do some big things. We've got Sam McGuckin out there, probably looking to take the Rob matchup. And we've got Andrew wearing the 1 glove. He's a very springy player from Singapore. Expect him to make a few plays.
And Latimatis is back out on the field, so he's not keen for UQ to score too many more, I imagine. The game advisors have advised that the time for talky talk is over and the time for play is on. And the players have taken notice and the pull is up. Look, not that much over halfway, so that's a good field position for Sydney Uni to be starting at. And Lucas is coming to pick up the disc. Looks for Latimatis early. Easy popping. Sydney Uni doesn't have a lot of handlers around, a lot of players around the disc. and kind of it's making it a little bit more open for them. Big throw. That is a beautiful throw. Oh my God. That is a fantastic throw. Wow.
That's pretty phenomenal. You know, Rob's one of those guys that you look at making big plays on D and in the air, and then he comes out and uncorks a hammer like that. Normally I'd be pretty worried about putting anything in the air up near Sammy, but it's a pretty hard shape to read when you're playing defense. What a throw from Rob.
Yeah, I wonder if he's in the running for World Games next year. He certainly has a bit of completeness about him as an athlete, and I don't know. My short stint training with him on Colony this year, I was astounded at how good his pulls were, and to me, a good puller is worth so much in the game, and you know, can be worth 3 or 4 points in a game. So, yeah, I think that's one thing that Australia, as a ultimate nation, has failed at a little bit is developing a lot of good pullers. Like you'll notice here that a lot of teams are struggling to get the disc past halfway, and the wind's not that strong. So UQ's taking their time. They really want to score this point. Like they do not want to go to half 8-1, 7-1 at the moment. They want to close the gap a little bit at half time, and to be frank, it's not just about half time, because these games at time cap, you got to be within 2 or it's end. So they got to start clawing it back soon, or the time cap's going to kill their game for them. Immediately they just look deep, and it's cleaned up easily.
Yeah, you'd like to see that shot coming just a second later when Sam and Linus are in the end zone. The wind really pushed that one down pretty quickly. Oh, but maybe the Huck and D approach pays off. UQ are now knocking. Let's see their end zone offense. We've got to get Andrew Hickman picking up the disc. I'm predicting a fat inside to Sam. Oh, Sam, bit of shake and bake. There it is, there it is. Oh, he's clearing, he's going to look for his dump. Easy swing to Z. Z looks off James and hits. Oh my goodness, Sam McGuckin providing an offense. Beautiful. Someone's got to put a mark on that kid.
Yeah, maybe UQ noticed that no one can catch the frisbee on the chest, and so might as well just go and play it down this end and wait for someone to drop a cold one on the chest, which did happen there. But a nice take. That was a sharp throw into the end zone, solidly taken. So someone out there showing how the disc should be caught, and good for UQ and good for us as spectators, keeping the game a bit more alive. 7-2. And a chance to get some D on. Like, you really got to fire up on D and start to claw this back. Once you get firing as a defensive team, anything can happen. So however you dig deep and find that whatever sort of defense you got to play, and maybe you just got to change and start playing man defense, play person defense, because you know, like, it can be hard to fire up in zone, and unless you're like generating lots of turns, you know, it's hard to maintain the pressure on the other team in a zone. So it might be time to just look at some hard man and just ask your players to get blocks for you. And when you get blocks, you just jam it up the other end of the field. So we'll see.
I don't know, selections of fuck this year. But whatever.
So pull's about to come up from UQ. Who's that pulling there, Liam?
Caleb. That's Caleb, the lefty on the disc. He's one of UQ's rookies. Let's see what he's got for us. Oh, gets over. That's a. Oh, what a beautiful roller! I'll take that pull up wind any day of the week. I'm not saying that his pull went further than Lato's, but his pull went further than Lato's. Lato now trapped on the sideline. Oh my goodness. We're going to zoom in there, covering the inside. Beautiful around to Lucas. Gets down to save it, and Lucas just finds that gap. You sit off to the races.
Yeah, lucky one.
But UQ's fence are there, and they seal well. Big swing. Way to see the field. Lucas now looking. Just wants to get a quick dish, and Lucas is just seeing the field real well, and it's been popped up to Linus. Oh my goodness, Linus Mueller, what a deep threat. No Sam McGuckin on the field. Let's see if our UQ lads can still work it out without Sam being that pressure release for them. We've got Andrew cutting break side, beautiful around, and that's a great oh dear. Bit of contact on that bid. No call. UQ and UC have set the standard for contact pretty early on. Both teams are really leaving it all out there. It's a great block from Lucas.
Yeah, so Latamatis picks the disc up for the umpteenth time this game and shoots it into Oscar in the end zone. And again, that is one of the advantages of having Lado pick the disc up, is that he's not scared to throw the goal when the goal's there for the asking, and it helps the team a lot to have a player like that on the disc, I think. So, half time. Blowout. 8-2. It's a pretty tough ask for UQ now. Like, they've given up a 6-point break. And, yeah, Sydney Uni is not looking like they're in too much trouble at the moment. Hey, Liam?
Hey, you said they have a great program, hey? A bunch of athletes, a bunch of really strong world's players on that team who are doing a great job steering that ship. UQ really going to have to rally and mix it up. I agree. Start running some man defense, some match defense, and ask some of the big boys in that team to make plays for you. We saw James get a huge layout in that end zone. We see Linus being an aerial menace. Just gonna ask UC to start throwing those high balls up and UQ start bringing him down. Not looking too bad on offense. They've found their rhythm now. They're moving it pretty well. Just every now and then there's one cold drop or the wind bubbles it. And I wouldn't say the wind's too big of a factor. I don't think it's in their head anymore. Maybe some green is showing through with some of UQ's rookies, but they've done a fantastic job this campaign. Yeah, it's UQ's game to take right now. You said just have to hold on.
Yeah. So, yeah, look, the wind is still a factor in this game, no doubt. Like, we saw how hard it is to generate those longer kind of options. Although, I've got to say, the very first point of the game when it was very windy, Sydney was hucking upwind quite happily, but we haven't seen that again since that point, really. They hucked it 4 times upwind in the first point, but not since then. The EQ girls psyching up the boys. A bit of running man. And this is where psychology comes into the game, I think, and you've got to find a way to change the way the emotional state of your team, and yeah, it's a fun bit of team sport, actually. I think is trying to influence a team and bring them with you on a journey to victory. But you know, it's a tough ask when the other team has got some weapons like Sydney Uni has. So yeah, yeah. Look, the uni scene's interesting because you get phases of people coming through, and so it's very difficult for any, like as you said, Sydney Uni has a strong program, you know, and partly it's the program, partly it's the benefit of having some juniors coming through or the right people going to that university. So yeah, I think one thing about University Ultimate, same with under 22s and under 19s, is you know, any university that really puts in a lot into development over a number of years, they're going to reap the rewards. And you know, you can pretty much over a 3-year period, you can breed a champion team or train a champion team with whatever raw resources you got. Yeah, I'm interested in seeing how we can bring University Ultimate to like a more elite level, actually. And like, I guess what we see is what's in the US Ultimate, and that's a pretty massive part of the high performance scene over there, is their College Ultimate and the level of play at College Ultimate. And I think there's a lot of things we could do in Australia to kind of do that same sort of thing in our college, in our university system.
Yeah, it'd be great to see that same level of competitiveness that the US has. Oh, James Fryer, he's had a great bit of it. That's a huge grab from UCIP play though. And they're up. Oh, he's looking to the end zone. He's moved to Fraser. Fraser's used to these conditions. He's lived in Scotland his entire life. What snap on that throw. Lucas gets up. And a beautiful shot back to Fraser. Fraser pointing. And Rob's probably going to throw another tasty hammer. Oh, he goes with the blade. But Sam's there. Sam gets up. My goodness, that boy can jump high. Potsy, you're wondering what we can do to make AGs more competitive? There's a few heckles that said, have it at the Gold Coast every year. Just have it at the Gold Coast every single year. See, looking now, he's got his reset. Goose busts up line. He's hit the swing. Oh, Phil just goes straight over Fryer's head. The boys are going to get back now, and a cheeky little bump from Igor. But UCIP plays through. Lucas on the disc, he's looking at the end zone now. Quick dish to Rob. Is Rob going to hit that huge hammer? Linus is baiting him. Lucas very, very happy to hit that inside. That's a big grab, but he's been ground stripped. And Toby from UQ is off to the races. And UQ are just going to walk it up. There's not much wind now. Let's hope we see some long balls going up to these big UQ athletes. Goose clearing through. And UQ are going to have another shot at it.
You might as well go.
Don't worry. Beautiful inside. Oh, it's just a great run through D by one of the ends.
I'm on. Fraser with the disc. Fraser McDonald. That's someone whose last name I know. And he swings it out. Haven't seen him much with the disc. Mostly been marking. He's trying to learn how to drop the disc as well. He's a good player, Fraser. Only with us for a short time, but I did play Beach Nationals with him. Took home the title. And they're moving the disc a lot, Sydney, but not making any progression downwind. Rob Andrews tries to fix that up, but just a little bit too sharp, that throw, not pulled in by his receiver. And Linus Mueller's going to walk it up to the corner cone. Yeah, so I met with AUS earlier this week, and I think there's a lot we can do to work with them to kind of, yeah, maybe move University Ultimate to the next step. But yeah, I don't know what to do about the cost of uni games, because that's obviously a big issue. But maybe more acceptable when it's in the Gold Coast than it is in other places. Oh, great block. He saw that coming. And Linus Mueller, great read, great layout block around the mark.
My goodness, I froth that sort of play. Linus Mueller uses that length. Like I said, and Fraser tries to get it back, but Linus uses that body so well to seal out the player. Sam providing unders as he always does. He's going to try and hit that around, and Linus is off to the races. Beautiful leading flick. Linus Mueller gets right up for it. Igor is now busting deep. Is he going to lead Sam into the end zone using that speed? There's a bunch of UCIP players there. Great block from Linus Mueller. Oh, and Fraser's busted, but there's been a call. Boys trying to get their breath back after that explosive start. Oh, Linus Mueller, showing that he's more than just an offensive giant. Getting some huge layout blocks all throughout this campaign. Rob on the disc now, looking downfield. Oh, and Sam gets a foot to it. Fryer's seen it now. And Fryer's gone up and made a great play there.
That was the potential brother-to-brother connection, but didn't quite come off. That was a great touch on the foot block there. So, UQ has it. Around the brick mark, around their own brick mark. The wind's significant. There's a big bank of cloud coming. Kind of hopeful that one way or another this gets sorted out soon. They're not generating a lot of good cuts here, and that shows. It wasn't a confident throw, and he didn't really want to have to throw that option as the last resort. Fraser McDonald wants to throw the goal himself. He's put that out, just out by 20 metres, but it could have been in. You can see that Latamatis isn't on the field. He does really kind of control their offense, doesn't he?
Yeah, Lado's such a force behind that disc. Such poise, such confidence. Something that's matched by our very own Z. Look at him stroll up. He's looking tall. He's looking confident. He's going to march it up to the end zone line, tap it in. He's got that disc moving with those beautiful inside breaks. UQ ladies are providing some great sideline support. Oh, he's trying to kick the cone. That's in fact a violation, but they play on anyway. Oh, there's a bit of cluttering and a pick called. UQ really have to clean it up if they want to get it off that sideline. Had the pleasure of coaching the UQ women's this week. And I want to say that UQ women had the best sideline out of any team I've ever seen. Just great culture that you really can't teach. They just have. Oh, is he? Oh, it's unfortunate. Really tried to force it. There wasn't a lot happening downfield, and now UC are looking.
Yeah, it's one of the good things about uni games moving to mixed gender is that the brother and sister teams, I think, have been doing a really good job of supporting each other. So Lucas brings it in, looks end zone. That's too big. That's floating. The wind's got it. Yeah, and so yeah, UQ's it's gonna be a long walk, and Jackson Bocce's got a long jog to go and retrieve that disc. Yeah, one of the good things I think about moving to single gender or split gender is that teams have this natural brother-sister combination that can support each other on the sideline. They don't really see as well in the club season, like even if a city has a men's and women's team, they don't always necessarily support each other as well as they could. Certainly in Sydney, but Sydney is a multi-team city, and there's not necessarily a natural allegiance between the teams. So UQ moving it up. I'm going to give it to Liam to call the names.
We've got Sam who throws the easy. Oh, that may be a turn. Oh. There was a pick called, and Linus Mueller stopped cutting for the disc. The ruling is in fact that if the throw goes up, the cutter must go and catch that disc. But Fraser McDonald showing great spirit there and saying, hey, I saw that you stopped cutting because of my pick. Have it back. Sam's on the disc. Oh, Linus cutting up a storm. Way to turn his hips. Fraser's got a hard matchup ahead of him. Oh, a beautiful lead to Sam. Sam gets up. He's looking end zone. Oh my goodness. Sam McGuckin, he's been really working on his throws. Look at him dance. Oh, beautiful inside from Goose. Hits Sam, but another big pick called. Great bit on Lucas across the mark. Trying to pressure at that inside, but say what you want about Goose. Jack Allen's got a plethora of break throws that he uses to his advantage. I think the disc will stay on Sam McGuckin, and UQ are going to have to go into their end zone set. Let's see, Linus Mueller cut up a storm downfield. He'll be cutting up treats for everyone. Oh, Sam might put up a... Oh, he's pivoting. And Rob reaches. He uses that length to try and get the sneaky hand block, but just knocks it out of Guk's hands. UQ well into their end zone set now. We've got Toby at the front of the stack. Oh, Sam throws a lovely around, but Rob uses that length to get a filthy foot block. Sam and Rob trading pieces of feet each time. It's a beautiful matchup to watch, and one that I think will probably be a staple of Australian Ultimate every time the Mammoth boys play any Colony lads down south. Once again, Lucas is marching to pick up the disc. One pass offense.
I don't think so. Oh, but Fraser wants it to be. And that's a good run, and that could just keep going all the way to the end zone, just outside. So pressure on. He's got a single cutter. He's open. Oh, he almost drops it. That was a great run by Fraser McDonald, and a great throw by Lucas that just got a little bit of trailing edge on it that just allowed him to float it up deep for Fraser, and Fraser made sure of it and made sure of the goal as well. So this game is pretty much done, really. Like, given the time cap rule. Now, normally you'd say there's hope, but when when you've got a clock that's going to kill you, then there's not really. But UQ has looked good, and I really don't think the scoreboard necessarily reflects how well they've played with Pat. Like again, in that point, they attacked the upwind end zone a number of times. Just maybe needed to have it in the right person's hand at the right time and have the right person cutting into the end zone. Like, we haven't really seen Mueller take off deep yet, have we? And nor take off. I'm not sure who his preferred upwind hucker might be, but if you can time it so that if you're the best thrower, even if the second best thrower is getting the disc, and you can run deep and time it off them, it can be often pretty unstoppable. The thing I love about Ultimate is when you know who you're going to throw to, and it's like there's two people on the field, and especially when that player is like 6'5", then it's a simple game, and So UQ with some downwind offense. Sydney Uni not really taking anything for granted. They've still got strong lineups coming out there. A couple of Australian players. That was a horrible pull by Rob Andrews, I've got to say. But UQ's got it maybe midway through into their half. And they're swinging